So in today's bite-sized tutorial, we're going to cover chest pain, and I'm going to explain what chest pain we're typically more concerned about and what chest pain we might be less concerned about. Of course, if it were in any doubt, we're going to call for an ambulance. But typically, chest pain associated with a heart attack will be heavy, crushing, radiating particularly to the left arm. It may radiate into the jaw, the neck, the back. In women, it may be less symptomatic and may present itself as stomachache or just feeling unwell. But typically, that is the type of chest pain that is associated with a heart attack. Chest pain that's typically not associated with a heart attack would be more sharp, stabbing. A patient will be able to point towards that chest pain, and that is typically more associated with something else that's creating discomfort in the chest area. Perhaps a fall and the area's been banged, maybe the patient's been suffering from a cough or chest infection or done some exercise that they're not used to doing, and that's put some strain on that area. So that's number one, it's type of chest pain. Heavy, crushing, radiating is more typically a heart attack. Sharp, stabbing pain that you can point to is more typically not. We will then look to see whether the patient, when they move, or breathe in, whether that pain changes. So in a heart attack, typically, because that heart is in severe discomfort, when you move or you breathe in or breathe out, that won't change the pain. That pain will stay as it is. Whereas typically if it's something muscular or from a chest infection, as you breathe in and out or move, the nature of that pain will change. So those are the two main areas to think about when considering whether chest pain is likely to be associated with a heart attack. Other symptoms of a heart attack include patient sweating a lot, going very grey, feeling extremely unwell, headache, nausea, etc. So that's a quick tutorial on chest pain that you should be concerned about. In summary, heavy, crushing, radiating pain that does not change when you breathe in or out or you move is more likely to be associated with a heart attack. You don't have to have all of those symptoms, but that's typically what would be associated with a heart attack, whereas chest pain that's sharp, stabbing, and that does change when you move in or out is more likely to be associated with a chest infection or something muscular. Much more during the course itself on First Aid 5, but hopefully that bite-sized tutorial has taught you something and has given you a flavour for the type of teaching that happens within the First Aid 5 online course.